Okay, great. So, we'll just start with my name is Natalie Maynor. I am the AmeriCorps member with the LGBTQ Grand Rapids LGBTQ Healthcare Consortium. I am the LGBTQ healthcare specialist, and I am here with Atabia Williams, who has created a Black and Brown maternal health toolkit. And we will be talking about her and why she created it, what inspired her, and what it is. So thank you for being here.
Thanks for having me.
Yes, of course. And so let's just start with tell me about like yourself and what inspired you to create this toolkit or why, like what's your why?
My name is Atabia Williams. I am a full spectrum doula, community-based doula. I'm a community sex educator. I'm have different certificates for a bunch of things, anything birth related, reproduction, conception, contraceptions, birth control, sex education. That's about my niche. I ended up creating the toolkit when I was a part of the transitional leadership program that Urban Core Collective has going on in Grand Rapids. I was a part of cohort 9, so woo woo. In my cohort, we ended up picking our topic, which was, I believe it was health and race. And within that group, we knew that we wanted to do something a little bit birth related, but we didn't quite know what we wanted to do. And we also didn't want to reinvent the wheel. So we looked at a community to see what was already being done. And then we decided to do a toolkit. So it was me, it was Jamesia, it was Octavia, Dawn, and Carolina. So we all ended up coming together to create this toolkit.
Wow. So tell me about the toolkit. Like what is it? Why would people use it?
Yeah.
And what is like the purpose of it?
So the purpose of the toolkit, so it's our Black and Brown maternity advocacy toolkit. So we wanted to have something that people could be able to use interchangeably and for a long time. So if you download the toolkit, if you go to the website, on the front of the toolkit, it talks about Black and Brown mortality. It also talks about some of the different resources that are here in Grand Rapids. So within those resources, when you click the link, you'll get resources for birth doulas, you'll get resources for midwives, you'll get resources for OBs and other practitioners that are in the Grand Rapids area. You also get resources for places like Baxter Community Center, where you can go and get food, clothing assistance, and a bunch of other places around the city. If you keep flipping through or if you keep clicking through the toolkit, there's a calendar on there where people can write down their information. There's a note section. We also have some phrases and some questions that you can ask your provider in case you forget or in case you really don't know how to advocate for yourself. So it's chock full of information, and we wanted it to be kind of well versed so that everybody can use it. Even though the resources are catered to Grand Rapids, anybody can use the toolkit if they download it.
Wow, that honestly, that sounds so cool. I'm so impressed that you all created that. How long did it take for you guys to put together the whole kit?
So within our program, I can't remember exactly, but I want to say it definitely took maybe about a couple months. It was a part of our big project, so we had to create something. So we chose to do something tangible. So we actually have stickers. I don't have my sticker in the back of my phone anymore, but we actually created little stickers that have the QR code on it, and it says Black and Brown Maternity Toolkit. And those stickers we've posted in numerous places around Grand Rapids. We wanted to make sure that we kind of posted them in unconventional places, so like the gas station and the library and your local food spot so that people can be more aware about what's going on. I always like to tell people, even if you aren't pregnant, you know somebody that's going to be pregnant or you know somebody that has been pregnant, and these are the resources that they need. So it took us about a couple months to do it. We had to get the sticker printed. We had to get all the information on there. We really took pride in making sure that all of our resources and all the people that we put on our toolkit were vetted. So everybody that's on the toolkit or that's listed on the toolkit has been vetted by the community members. So they're inclusive to Black and Brown people. They're also inclusive to folks in the LGBTQ plus IA community as well. So we wanted to make sure that it was for us by us. Everyone that was in my TLP group we're women of color. So we wanted to really make sure that we represented that well. And even as a birth worker, I'm always for my community and for us by us. So it was really important that we made sure that we had good people on there and good resources too.
Sure, yeah, you have to have like qualified people who you know are legit and aren't gonna, treat people differently based on whatever.
Yep.
So the way that you've created this for two communities you're a part of as a birth worker and as a woman of color, that clearly means a lot to you. So how does it feel now that it's out and now that it's completed and it's out into the world for people to use?
It's always so surreal because I graduated the program, I believe last year. So they've already graduated another cohort. And when people talk about the toolkit, I'm always like, wow, we really did that. That was really a good thing. I actually just went to the health summit that Graha had, and I got to talk about the toolkit because as a doula, when we talk about some of the resources that we give people, we always want to make sure that people are going home with actual tangible resources. We don't want people to just go home with things that they have to look up. So another reason why we created the toolkit is so I can actually give somebody something in their hand. It's a tangible thing. When you go to the website, you're able to download the PDF documents to actually have in your hand. So it's surreal. I love it. I love going on the Squarespace to look at the traction that it gets. Especially when I can see that the people have scanned the QR code because they're just all over. So sometimes I don't consciously think about it, but then when I see people or when I talk about it, everybody's like, "Oh, that's such a good thing," and I'm like, "That is a good thing." I'm so happy we did that for everybody.
Yeah, I actually was at the High Summit as well, and I heard you speak because that's where I think Jenny heard you speak, and she was like,
Mhm.
"Oh, I have to go and speak to her right away." And then we were sitting at our table, and she was like, "You're gonna have to interview her," and I was like, "Oh, that's great, sure." She's like, "I have to talk to her." So so great. So I'm glad that you get the chance to promote it and like speak about it yourself. And it must be really cool to like speak about something that you created, not just something that like you've used or has helped you. Like that would be cool as well to tell others about it, but like to tell something about something that you came up with. So
It's been so great, and even the folks that I created it with, like, they're out in community doing really, really great things, so they're able to talk about it in the spaces that they take up, even if it's not directly related to birth. Again, you we're always gonna know somebody who is having a child or, somebody who is affected by the mortality rates too, so it's been so great.
yeah, that's really awesome. And what just like I'm getting curious now, what made you want to become a doula? Like what do you think the main differences are between like giving birth using a doula or giving birth using like uh an OB?
So, I could go on a whole soapbox. Um,
Say
well
whatever you want. Say go as long as you want to.
I so I am the program manager. Well, I'm the program trainer for Day One Doula Collective, which is a community-based doula program that's here in Grand Rapids. Kiera Baskin is the program manager for that program. I started off as an intern before I graduated from Grand Valley. I always knew that I wanted to do something around women and babies. Um, but I knew that I didn't wanna work directly inside the system when I started to get older and go through college and, major in women, gender, sexuality studies and public and nonprofit health, I started to realize that the system really wasn't for Black and brown women, Black women specifically. So, I was kinda teetering the line between being an OB and being like a nurse practitioner or some type of nurse, and then I heard about a doula. And I'm like, great, this is everything that I wanted to be. So I ended up missing the deadline to apply to the first cohort of the program. I was so sad about it. And I literally was like, you know what, guy, if you don't want me to be a doula, that's fine. I don't care. And Kiera actually posted that she needed an intern, and all of the requirements that she needed for an intern was literally everything that I had. So I ended up emailing her and we connected right on the spot. And I've been with the Day One since before I graduated from Grand Valley, which is about 2 years ago. So I got to sit in on the first cohort. I got to get trained with the doulas. I got to get CPR certified and build that community. And then I got my certificate to be a doula. I always joke and say that I've been doulaing people forever because when you think about it, a doula is just somebody that cares for people. So when your friend goes through a heartbreak, you've been there for them. You know what to say. You know
Mhm.
how to help them. You know how to nurture them. If I went over in front of people, people are gonna know how to come up to me and ask me, "Am I okay?" And to give me the things that I need. So we've always dual somebody. I just do it specifically for birthing people, but I've been doing it for quite some time now, and I love it. I always tell people it's my God-given passion. I know that I was put on this earth to help people. I'm a nurturer by trade and a comforter. It's in my spirit. So to be able to show up in such a sacred place and to be trusted with birthing people's vulnerability and just the intimacy in that space, I wouldn't change it for the world. I thoroughly enjoy it.
Oh my gosh, that's awesome. I love hearing people talk about stuff they're passionate about, and I'm sure you're an incredible doula. How long have you been a doula?
I've been a doula on paper for about 4 years. I've been a doula off paper my whole life.
Your whole life.
I've always helped around when my family members had babies. I've always been the person to really cater more so towards just the woman or the birthing person than like the actual baby. Because you know, when people have babies, everybody's around the baby, everybody wants to hold the baby. But what about the birthing person? They need that support too. And if they're not okay, then the baby isn't going to be okay either. So that's definitely why I gravitated towards that. And even when you look at the statistic rates between Black women specifically that have doulas and the ones that don't, doulas statistically bring down on the C-section rates when we're involved. Our clients are more educated, they're more aware of their bodies, they're more aware of the choices that they have. Their babies are more likely to not be preterm, so they're more likely to come on time. So the statistics are there. I'm just happy to be a part of it.
Wow. And where, sorry, this is all so cool to me. Where do your patients give birth? Do you do home births or do you work like at a birthing center or?
Yep, so most of the patients that I have taken, have birthed inside of the hospital. Most of
Okay.
the clients that we get that come through day one are community members, so they traditionally go to the hospital. Um, in our training course, we teach our doulas about the difference between a midwife and an OB and a doula. I know some people try to use them interchangeably between doulas and midwives, but we always say that doulas coach and midwives catch. So we don't catch babies, we coach you through the things. So we provide
Okay.
both physical, emotional, and spiritual support, and then the midwife would do more of the medical side. And then between the midwife and the OB, technically OBs are there to perform surgery. If you look at what the definition of an OB is, they are someone who is there to provide surgery. But if you don't want surgery, then you actually technically should be going to go see a midwife if you want a vaginal birth.
Wow. Okay. So you are always working with a midwife.
Nope, not always.
No.
So
Okay.
in the hospital so we meet our clients wherever they want to go. So if my client wants to go have her baby outside in the garage, I'm gonna I'm gonna be there outside in the garage. So with our scope of practice or with what we train our doulas to do, and something that I live by is we always give our clients evidence-based information. So we always want to provide you with as much evidence as possible so that you can make your own conscious decision. It's not about what Atabia wants. It's not about how I feel. It's not about what I've been through. It's about what my client wants. So whatever they want, I'm going to be there to support them.
Wow. Okay. This is so cool. So like taking a bit of a darker turn, can we talk a little bit about the mortality rates in the Grand Rapids area specifically, but mostly I know that the mortality rates for Black and Brown women are much higher. And can you give me like some numbers and why that is happening? Or yeah, just a little bit more about the maternal mortality rates, because I know that they're way too high and just devastating numbers.
Yeah, so I know on a broader scale that Black women are up to about, I think, 6 to 8 times more likely to die compared to their white counterparts in childbirth. And the simplest answer is racism. It's not race. We can't sit here and try to attempt to blame Black women specifically because of our race. We have to blame it on racism because that's the problem. And I always tell people when we talk about the systems, The systems aren't broken, they're working exactly how they're supposed to work, but the systems don't work to benefit Black women. Even when we go back to thinking about history as in a larger scale, and we think about the father of gynecology, who is Dr. James Marion Sims, we always hear about the good things that he did for the advancement of gynecology, but we don't hear about the enslaved women that he worked on, and we don't hear about their names, which are Anarcha, Lucy, and Betsy. And he worked on these women without anesthetics, and these were Black women, and he worked on their private parts. Um, so when we think about those times when there wasn't anesthesia, and think about where they were working and how not advanced technology was then, we don't give them enough credit for the sacrifices that they made, which is why gynecology is what it is, but we just hear about this white man and all the great things that he's done. So historically, the the field of gynecology and the field of medicine has never been for us as Black people, but specifically Black women. Even when we think about the books that are still being written to this day, or the older books that have been written, they were written by white men. They were written by people who look like me or people who have body parts like me. So when we think about the training that they're getting, it's old and outdated. There's still some doctors to this day that think that Black women don't feel pain, or that our skin is thicker than other people's skin, which is literally why we're dying in the hospital, because they're not believing in us the first time.
Yeah, that's absolutely horrible. And I just the work you're doing is just obviously so meaningful. And I know that you know that, but yeah, that and what are like the biggest issues you think in Grand Rapids, other if there are other issues than mostly racism? I know you said is like the number one issue, but what do you think people are doing wrong, or if there are any other issues, or if that's just kind of the main one?
I think in Grand Rapids, I'm originally from Detroit, so I have a big culture shock every time. I mean, I've also been here for about 7 years. So, but it's completely different from growing up on the east side of the state, especially growing up
Mhm.
in Detroit when everyone looks like me. Um, but I think it's a little bit of that relatability part, but it's also, it's a mentality shift about helping each other. Specifically in Detroit, I know a lot of people who do a lot of the same things, and we can all come together and we can all band together. And I believe that in Grand Rapids, it's a little bit different. And it takes a while for us to build community and build a bigger foundation, to help each other. Instead of reinventing the wheel, how can we help somebody else who's already invented something? How can we band together to help a smaller cause become a bigger cause? Um, but I do know in the communities that I sit with that we are out here doing the work, and that we are banding together, and that we are doing the bigger things so that everyone can be okay.
Yeah, I so you think a lot of the big differences between the maternal mortality rates in Grand Rapids versus Detroit is just there are more people of color over on the east side, so they might be more used to dealing with it. And in Grand Rapids, they just haven't had as much experience, or
I think a little bit of yes and a little bit of no. I really think it just boils down to the systems, in general, and just the willingness to listen to community and have community involved in the things that you're doing, and actually talking to the people that you're trying to help. You can't help a specific group of people if you don't have those people at your table, or if you don't
or
allow them to be at your table, or give them the resources to present themselves, and actually listen to them, and actually take what they told you into consideration, but also apply it and make it better, and not do what you believe is going to be right for that situation.
yeah, yeah. And what would you say to, let's say there is someone watching this interview who is like a white man who's an OB or whatever, who is kind of watching this and is thinking, oh wow, maybe I do some problematic things. What would be like, if you could just say, boil it down to as short as you could, what would you say? Where would you tell these people to start? People who do want to change, people who are realizing that they might need to update their practices.
I would say you have to look within, you have to look at the people that you're serving. Me as a community-based doula, I'm in community, so I know my community. I can see my clients walking down the street. I can see them at the grocery stores that I shop at because I'm in community. Most of the people that practice at these hospitals that are in community, they don't live in community. They don't go to community events. They don't show up. So there's a disconnect when we think about the whole body care of a person. It's not just when you see me when I come into your office. It's when you see me outside with my kids. It's when you hear about just some of the random things that I have going on. So I would really say you have to start debunking the way that you've learned. You have to use desubjugation. So it's taking what's at the forefront and what's not at the forefront. So when we talk about mortality and we talk about anything on a broader scale, we always have to think about who's being left out of this conversation. Most of the time, people of color and Black women and queer folks are always being left out of that conversation. These are the people that we need to be paying attention to, because if we get them the resources that they need and the help that they need, then pretty much everybody else that's ahead of them is gonna also have the information that they need to.
Sure. And just like people who aren't, white, straight, cisgender people who also give birth deserve to, I mean, obviously be treated equally, especially over something that they can't control,
Mhm.
So I definitely, yeah, I think you would just kind of say to and remember why that these providers got into this work in the first place.
Yeah, I think that's another big thing. When we think
Yeah.
about why did you get into this work? Again, we know that the system works how it's supposed to work. So we know that you're only allotted, X amount of time to be with the patient. We know that you do have to go see other people. We do know that it is kind of cookie cutter, boom, 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 bam. But we don't want to forget about the fact that there's somebody's life on the other end of this. And we can't forget that there's humanity on the other end of this. There's vulnerability on the other end of this, and that there's actual people on the other end of these conversations. And we can't treat people like tickets, and we can't treat them like numbers and just another patient that you saw or another problematic person. Again, when we think about it on a wider scale, I've been to so many births of people that I've just met in that same setting, and I don't know them, but I do know that they need my help, and I do know that I wanna be there for them. So, building that type of relationship, it doesn't take that much time, but it lets people know that you care about them, and it lets people know that you actually want to see a good outcome for them, and that means a lot to people.
Yeah, and just I feel like I mean, the reason people should go into, healthcare and all that stuff is because they want to help people. And it's just maybe remembering that because I'm sure there are some people who go into it for selfish reasons, but I feel like the majority of people who go into healthcare are just because they want to help others.
Mhm.
And that's probably just the biggest like reason. And I know that the maternal mortality rates are just crazy high, especially for this day and age and for the technology we have here in 2024. Moms shouldn't be dying.
It is. Well, when you think about birth and what it used to be, we didn't have all of this technology, and we didn't
Right.
have all of this westernized medicine. And it kind of wasn't until birth started getting more regulated and into the system that we started having all these complications. There's no reason why the United States should be so high compared to other countries that don't have nearly as much technology as we're doing. But when we think about birth is a physiological thing. It's gonna happen. We never really needed all of these technologies and all of these advances for something that our bodies were made to do. If we let our bodies do what they are primarily or instinctually gonna do, we most of the time have better outcomes.
Yeah. And what do you think that other countries are doing better so that their rates are lower? Like, do you have any idea what other countries are doing? Like, why are ours so much higher?
Yes, because we have a lot of chain of interventions here. So chain of interventions are some of the things that get in the way from you having the physiological birth that you could have. So when you get into the hospital, you're automatically on a time limit. When you get into the hospital, there are certain things that if you don't do those things within that time frame, then they're going to start pushing you to do other things. You can't, if you don't let your body do what it was naturally going to do, and you start inducing and you start inductions and you start pitocin and you start all of these other things, now you're not giving your body a chance to do what it was already going to do from the beginning. Um which causes you to be stressed, which causes you to be tired, which causes your body to go into this shock. All things you don't want to happen when you are having a child. When we think about the other countries and other people and just other cultures, they let birthing people go to themselves to go do what they need to do. Um, there's unless you're a high risk pregnancy, there's no need for all of these interventions that the hospital is giving you. But with these interventions, it causes a lot of complications.
What do you think the most problematic intervention would be that providers in the United States do comparatively to other countries?
I think I think it's bodily autonomy. When you get into the hospital, it's almost as if you're kind of signing your body over to them. And it's almost as if it's their way or the highway. So like I said, when you get into the hospital, they want you to you're in the hospital and they want you to to be complacent to them, but they don't want you don't want it to be the opposite way around. So are you going to birth on your back like how we were trained to do? Because that makes sense for me as a provider, even if it doesn't make sense for you and your body. I don't want you to go on your back. And these are some of the things that I've seen inside of the systems. Um, if you're a patient and this is your first child and you don't have support and you're completely hysterical, you could be written off as irritable, and you could be written off as not patient and a little like unruly. But no one's actually taking the time to again treat people with humanity and meeting people where they are and actually understanding, because you're on a time crunch. If you came and you've been here for about 24 hours, well, now on my clock, I said that you need to have this baby by now. So then we're going to start these chains of intervention and get you out of here so that we can get the next person in here.
Sure. So other countries just let nature take its course more and just let the body do what it was meant to do.
Mhm.
Yeah, because women used to, I mean, hundreds of years ago, women used to have kids in fields and outdoors and all over the place. And now it's like what women are dying when we have all these things that are supposed to be so much better.
Yep.
And it just seems like sometimes it helps and a lot of times it clearly doesn't because of how high the maternal mortality rates are.
And in a lot of cases, it does. I don't want to just write off the hospital in general and say that it's just
Right.
a terrible place and nobody should ever go to the hospital, because I've
Yeah.
seen some amazing births inside the hospital. Um, but there needs to be a bigger system change. And I think that's the bigger conversation. A lot of people, I don't think they don't wanna have it, but it comes with actually acknowledging that the system is messed up to begin with, and acknowledging the harm that the system is doing, and then figure out how are we gonna fix that from the inside so that the people that we're caring for aren't gonna continuously and die from these procedures and the things that we're doing.
Yeah, I think one of the biggest ways that people will be able to fix it from the inside is because now we have people like you on the inside, people who care, people who aren't just these white men who were the ones who pioneered the field, but the people who are going to be able to change it are people who see the world differently. So you're really doing incredible work.
I'm trying my best. Doulas are not the answer, though. We are not the end all be all, but
Mhm.
we are actively trying our best. And a lot of other people who aren't directly taking on births or, helping with birthing folks.
Okay. Yeah. And so back to the toolkit a little bit. What is like your favorite part of the toolkit, or what's your favorite thing that was you guys included into the toolkit?
I think my favorite part about the toolkit is the aesthetics. Octavia Inc. She created it. We love Octavia. It looks cohesive. It works. I thoroughly enjoy the fact that you can kind of make the toolkit yours, even if you don't use the resources that are on it. Like I said, it has calendars, it has a planner on the back, it has a little nutritional journal on the back
Mhm.
of it. So even if you aren't technically a birthing person and you aren't having a baby, you can still use it in your every day-to-day life. And even some of the phrases that are in there, even if you again aren't a pregnant person or you aren't a birthing person, you can still use those phrases to know how to navigate yourself inside of the hospital and inside the doctor's office. Because a lot of people get very, very fearful when they go to these doctor's offices, especially by themselves, because we don't have the language for it. And a lot of us suffer from white coat syndrome. So whatever my doctor says is what I'm supposed to do. If my doctor, says this, then I don't really feel like I have the capacity to answer a question. So
Yeah, that and the toolkit is for providers as well as people who are pregnant or giving birth or know people
Yep,
who are?
I would love for providers, to use the toolkit too. It again, it has the resources, that are in the community that people can use, and they can just also see, like, some of the things that their clients could potentially need and how they can integrate that into their practices.
Yeah, so it really is just for everyone. It's just although it is focused on Black and brown people who give birth, it's really just for anyone who's interested and
Mhm.
wants to learn.
Yep.
That's really awesome, and you've clearly done a really good job of getting it out there and posting it in those creative locations too, just like everyday locations where, I'm getting gas, I'm just sitting here waiting, and I might look around because I'm a distracted person and I see the QR code and I'm like, let's scan
Oh,
that.
yes, right, people love to scan stuff because
I
I'm no
do.
so I love to scan stuff anyway, so yeah, let's just stick it anywhere and see where it goes.
Yeah, and clearly it's been successful so far. It has been, right?
Yeah, it has, it really has.
Yeah, and we'll definitely in the link to this interview, we'll link the toolkit so that people can go explore it and look through it. So, just kind of wrapping it up, I wanted to ask, why did you feel it was important, or why did you say yes to doing this interview with the Grand Rapids LGBTQ Healthcare Consortium specifically?
I felt it was important because for one, I'm on the consortium. For two, I love to always put a face to the things that I'm doing. And so that people can hear the passion in it. It's never about me, it's
Mhm.
always about the outcome and it's always about what I'm doing. Um, and I just want people to know how great it is. And I know how great you guys are and the things that you're doing, and I really support the work that you're doing. So that's
Yeah,
I said yes to this because I know it's gonna fall on good ears, and I know that a lot of good people are gonna hear this. And the more that people know, and the more that people are educated, the better off that a lot of people are gonna be.
absolutely. Thank you so much. And I hope you know how much we at the consortium, we support and appreciate and value the work that you're doing as well. And we're so excited and happy that you said yes to speaking with us, and excited to get you out to our audience as well.
Thank you so much. I appreciate it.
Yeah. And just, is there any other final thoughts that you want to put out there before we hang up?
Know your body, know yourself. The better you know your body, the better nobody else can tell you about your body. As a community sex educator, as a birth doula, grab a mirror, check yourself out, look at yourself, do all of the things so that nobody can tell you about your body. And if you ever need any help or any information, you can always call me.
Okay, thank you so much. And we will be sure to put all the information into the link in this video. And just again, Atabia, you are an incredible person and you're doing amazing work. Just keep it up. And thank you so, so much for speaking with me tonight.
Thank you.
Yeah, it was great to meet you.
You too.
And just so, yeah, send me the recording whenever you can.
Literally me trying to figure out how to stop it.